Hello. So this is the group We Will Make It Through, and we are going to each be discussing the different disabilities that we chose. I chose to speak about physical disabilities, and the pamphlet, it brings awareness that it's important to make sure that ramps, hallways, and all pathways are safe and accessible. And we should make ourselves eye level to patients so that way they're not straining their neck when they have to speak to us. And if someone's in a wheelchair, we should make it low enough for patients to be able to see us easily. If there's like countertops where they have to pay, they're or if they're going to be using a card, that those machines should be accessible to them. And we'd want to help, we always want to help somebody that has a disability, but it's important to ask and just not assume that somebody wants help. It's better to just make sure that they accept the help and want the help, and then just wait for instructions on how we can assist them. And for number five, well, I think that if someone has a physical disability and they come in for a mammo, it can be challenging, but depending on the patient's limitations, the CC and MLO positions could be hard to achieve. So if a patient can't fully lean in, it'd be pretty hard to get the pectoral muscle um, in view. So there could also be a motion in the picture if somebody can't be stable enough. So for number six, my thought was that have you guys seen the stereo chairs for biopsies?
I don't
I
think so.
think so.
Yeah.
So when patients have biopsies, they put them in a stereo chair, and it's a special chair that can level up to the machine, and it has doesn't have sides, and the patient can move easily to get into whatever position they need. So I was thinking it'd be nice to be able to maybe transfer somebody into that chair, or if they weren't able to stand for
Yeah.
too long, they could sit in that chair for positioning. And just explaining the process step by step to the patient can help alleviate anxiousness, or just taking your time to make sure the patient's stable and understands the necessary steps will help accomplish a successful memo. So those are my answers.
That was a good way to like kind of go about it because sometimes I feel like we're in situations where we don't have like walkie-talkie patients.
Yes.
So it's like you have to work around it. So I guess my question in like regards, I guess this can go for like any disability. It's like, do facilities like train like mammo techs to like manage exams or patients with certain disabilities like that? Because, for example, like x-rays, like for comps, we have to do like a wheelchair comp or like things like
Mhm.
that. So that was
Mhm.
my question is like, I wonder for mammo if they are trained to like work in situations with people with disabilities to see like are there different routines or like different type of positioning that they could do. I always wondered.
Oh,
Yeah,
that's a
that's
good
such a good
question.
question.
I mean,
I
there has to be a certain percentage of women who are in wheelchairs,
Right.
or like, or just I feel like a lot of older women too are like kyphotic. And so it's
Yeah.
like
oh yeah.
to be able to, no, great question. I don't know. Maybe the teacher will be able to answer that for us.
Yeah, I like that question. I did ask one of the techs, well, how do you position somebody if they're in a wheelchair?
Yeah.
And she said, well, there is a way. I know well, some wheelchairs you can't take the arms off, but it's
Yeah.
nice if you can take the arms off.
Yeah.
Yeah.
But I mean, yeah, I wasn't able to see that one because I was actually doing x-ray, and then I saw one of the mammal techs bringing a patient back in a wheelchair, and I was like, darn, that would
You're
have
like,
been
I
a
want to
really
see
good.
that.
Yeah.
Yeah. Right. Well, I wonder too if you would have to add more views, like if you didn't get, because if the MLO and the CC, if you would have to add, she was saying like sometimes you just have to add views,
Mhm.
like maybe you'd have to
Yeah.
just keep adding views, but I would imagine it would still be kind of tricky to even add more views,
Yeah.
you know?
That's true.
I feel like that would be hard. Yeah.
Yeah. I don't know how it would be. But yeah, no. I wondered, yeah, I wonder if there's like a special chair that they just for mammo that they can figure it out. We'll
Yeah.
see. Yeah.
Yes, we will.
All right. Cece, do you want to go ahead and go?
Yeah, sure.
Okay.
So I chose neurodivergence. So number four is just basically summarizing it. I just put neurodivergence refers to difference in how people's brains work. It includes conditions like autism, ADHD, Tourette's, and more. Being neurodivergent means a person may think, learn, or process information differently than what's considered typical, um, but it's not necessarily wrong or disordered way. These differences can affect communication, social interaction, attention, learning, or behavior. And so, yeah, neurodivergent always have those walkie-talkie patients. This disability can affect a mammo exam in various ways. Like, for example, autism, depending on how mild it is, like a patient may not be able to understand or comprehend directions. Maybe holding a certain position too, especially like a mammogram.
Mm.
They might not feel comfortable. Maybe their attention span also is just very short. So I feel like it could be difficult even getting a good exam.
Absolutely.
Um, yeah, there's things like that. They may not feel comfortable. Um, and yeah, I don't know. Like, I feel like an exam could be pretty unsuccessful depending on how mild their situation or disability is.
Yeah.
Um, Number six was kind of ways to make the exam better or for the tech or what the tech could do to make the patient feel comfortable. Um, just finding ways to communicate and being very direct, not using like medical terms, just being very direct on what's going to happen. You can make the setting comfortable. If some people are sensitive to like light or noise, maybe dim the lights for them. Um, just basically being sensitive to their boundaries, um, giving them space to, be calm and just recollect themselves. Similar to x-rays, I would say maybe finding alternative ways to do the exam if that's a possibility. Like I said, we haven't learned too much on positioning in lab, but I would like to learn maybe different ways on how to handle different patients. Maybe having like a caregiver or a family member hold the patient, being shielded, holding the patient, if that's a possibility as well. Um, and yeah, that's what I came up with for solutions.
Have you ever
I
done an exam on
I
somebody who had neurodivergence? I mean, maybe not mammo,
I've
but
done
what
it
about
through
X-ray?
X-ray, and actually, this happened the day before I shadowed Mammo. I had a patient with severe autism,
yeah.
and I noticed he didn't want to lie on the table to do a hip X-ray. So I was like, okay, like let's do a hip X-ray standing. Like, and I was like, okay, there's alternate whatever you can do lying down, you can do standing. And he had two caregivers holding him on the side, and I mean, it had to be quick. So I
Yeah.
was like, okay, if we could do that for X-ray, I wonder if it could be done for mammo. I just don't know.
I think the caregivers are such a huge help usually because I
Yeah.
think it like gives them some sort of sense of comfort. So it would be awesome to be able to like bring them in. I know Mammo's a little more like intimate, but
Yeah.
I guess they're their caregiver, so they are probably used to taking care of them anyways. But
Yeah.
yeah, definitely.
Yeah. But
Yeah, I
yeah,
would imagine somebody would have to go in and stand with them, right?
Yeah, I would
With light
think.
on.
Yeah,
I
yeah,
would assume so.
I would think so too. Or I mean, or I guess it just depends on how severe they are too. Like some, I know that like some people who are autistic,
Mhm.
um, do better with like very direct directions and like
Mm.
so I guess it would just depend on the situation.
Yeah.
Yeah. Have you have you guys done like anybody with like sensory disabilities. That's what I covered. It was like
I
blind or deaf.
I don't
No.
think I've had, no. I
Yeah,
mean, I've had patients, older patients that are like, it's difficult for them to
hard of hearing.
hear or
Yeah.
even like respond.
Yeah.
Nothing, no like blind patients or anything like that.
So that's what I decided to pick, which I was like, I think would be very difficult. And it just kind of gave a couple different things that you could do for, I'll start with the blind or low vision. It says to identify yourself, communicate and announce yourself, and give descriptive explanations of what you need of the patient. Offer tours of the facility, which, or maybe like give like a verbal tour of like the exam room or wherever you're gonna do the exam. It also said you don't want the lights too bright, because that could cause some irritation with certain eye conditions.
Mhm.
And then sometimes you can ask the patient if they would like your elbow. If some of them like that, some of them do not. And then it also said something about the service dog, like if they have a service dog to, obviously ask if you can pet it or, you know, any of those things. And then also offer to read info to the patient because, we have to do the paperwork and all that for the patient. So maybe explaining things to them in detail. And then also let the patient know that there's a website that offers audio and video that if they wanted like more information that they could also watch that after the exam. And then for the deaf and hearing impaired, it said you may have to have a language interpreter, so somebody probably who does sign, which I guess it depends on some people who are deaf can read lips. It just depends on the severity of it. And then it says to speak to the person, not to the interpreter. So make eye contact. That's very important. Sometimes hand on the shoulder can be appropriate. And then also rephrasing things that may need to be rephrased if the patient has a hard time understanding. So obviously I think this would be very difficult to position. I guess I was thinking, for blind people to like be really descriptive and like whenever you were touching them, like let them know where you're touching them and how you're going to be touching them. Um, I think it would just be a little bit more difficult for the deaf. So I was thinking maybe to like show like pictures of what you're going to be doing or like a diagram of like how things are going to be going. Um, yeah. So I don't know. What do you guys think? What are your thoughts to make it easier
I think for like the whole picture thing, that was a good idea.
for the deaf?
Um, yeah, for blind people, I feel like that would be really difficult. Like my question is for like for the service dog, would you like have it right there with them or like would it include another person as well? Um,
To watch the service dog.
yeah, I know.
Yeah.
Yeah. Or do you leave the service dog out in the
Yeah, I was
hall?
like
I don't really know.
the
I haven't really
service
dealt with
dog.
it.
Yeah, I can only do so much or like
Yeah.
do they offer like I don't know, like
Yeah.
braille. So like for certain people who like need it. I don't know, like things like that. I don't know.
And
Yeah.
the radiation for the dog,
For
is
the
that?
dog, yeah. So maybe the dog sits out in the hall or like I don't know.
Yeah,
I mean, because I feel like service dogs are usually pretty like well behaved. So
yeah,
Hmm.
yeah. Or would it even be that much? Or maybe they stand behind the shield with you.
Yeah.
yeah,
No, because maybe it's not too much radiation for them.
yeah.
But I don't think I've x-rayed anybody blind. I've only done like hard hearing, like older people. But
Hmm.
I don't think I have ever x-rayed anybody blind.
Yeah.
Yeah, I haven't either.
Yeah.
When
I'm sure it'll
somebody's
come
hard,
up in our career eventually,
yeah.
you know? So,
Hmm.
yeah.
It's like with experience, we'll eventually have seen a lot more
Yeah.
Yeah.
than what we have now. And
Yeah.
learn, I keep thinking, like, what happens if this? Because I was reading some of the information and the different positionings, and I'm like, wow, what would I do if somebody
Yeah.
came in, with with that type of limitations, I would have no idea what to do right now at this point.
Yeah.
Yeah.
So yeah, it's like I think what the professor said, we might have seen 30 x-rays, but like, or mammals or something like that. But then a professional tech or a tech that's been a tech for a long time, I've seen 3,000. So
Yeah.
it's like there's so much. Just like with x-ray, I feel a little bit better now with have experienced more than when we
Yeah.
first started.
Yeah.
Absolutely. It still is a lot though, just to think of the when somebody's in a wheelchair or like it's a
Yeah.
trauma and the
Yeah.
person's in pain and you can't like move
You have
them.
to think outside the box.
Yeah, it is
Yeah.
definitely keeps you on your toes. I guess that's like, the exciting thing about it, but
That's
definitely
true.
challenging at times, that's for sure.
Hmm.
So, but all right, well, unless anybody has anything else or input, we can close up.
No, I don't have anything else to add.
I mean, it would be nice to kind of learn how to like work with patients with disability in
Yes.
mammo because
Yeah.
I feel like positioning is very limited. So hopefully we get to learn that or hear some stories of what our professor has
Yeah, I
dealt
agree.
with
And
patients. Yeah.
then I guess talking to more like mammotechs too, because I'm sure
Yeah.
after they've done it for so long, some of them have had experience,
Yeah.
doing it. So maybe whenever we have to do our 100 exams before, you know, we can pick their brains.
Good idea.
Yeah.
All right, ladies. Well, I will stop the recording.